Hey guys, how's everybody doing today? It's me, Dan Harrison, but you probably know that if you're here on this call. Um, it is Thursday, May 14th, and it's been a busy week for many of us, and we, are continuing to trudge forward in this life that we're in, and it seems that each day brings another sort of weird adjustment that I find myself making, and sometimes very subtle things. Um, we're Many of us are using almost exclusively Zoom or Ring Central or GoToWebinar, as we are in this case, to conduct our various organizational business and programming and outreach to our community, to our clients, to our beloved families, all scattered around Middlesex County and beyond. And I don't know, Greg. Maybe now would be a good time to bring up that one poll. How many hours are you spending on your computers staring into this screen? Yeah, I'm gonna do it. Um, oh gosh, I bet I'm easily 5 to 8 hours a day, I would think. Yeah. So just I'm curious what you guys would say to that. Uh, as far as the amount of time that you spend. Let me tell you a quick funny story. Last night we had a Waypoint interactive board meeting, and we hadn't had one for a while. And I'd kind of been on this kick of sort of lamenting to Greg that I couldn't, that I was really feeling like I was missing something. My button's not clicking. I can't choose one of those. Um, when it's funny how things sort of translate. So when I've noticed that when we're doing the Zoom calls or meetings, that people are much less likely to interject during the course of a session. Last week we had our exit conference for our financial audit that we had this year, and what we do every year, but it started in January and concluded, and then they were going to give us the report, and so I had myself on mute, and there were I bet easily half a dozen, maybe a dozen instances where I would have, yeah, probably more like a dozen, where if we'd been in the room as we normally are in the conference room, and the board finance committee would be there, and Bill's team would come in. They're the guys that do the hard work of managing our receipts and all of the other controls and everything. I probably would have said at some point, kudos to this great team, and maybe joked around with Steve Snow, who leads our the audit every year. But I found myself just not. It was like I'd go to take myself off mute, and I'd be like, oh no, I'm not gonna. It doesn't seem worth it, and I'll be interrupting Michelle. She's talking right now, or whoever it was, and I got thinking about what will some of the long-term repercussions be of this gradual, albeit gentle, maybe even some would argue it's irrelevant sort of shift away from some of the character, some of the lively, curiosity or irreverence at times in some of these situations, because I feel that that's the part of our humanity that sometimes there's this kind of intersection between the buttoned up business and reminding us all that we're human beings. And so I was puzzling over this and thinking, what are we going to do about it? And I'm a guy that I really feed up other people's energy. I love to talk to people. I kind of wear my my feelings like on my sleeve, as they would say, and so you often maybe will know what I'm thinking about something, and when I feel joy and happiness, it's very exuberant. And so I said to Greg yesterday, I said I want to do something that's going to be a little different. So this meeting started at I want to say it was 4:30 yesterday. I said let's do a fake Zoom bomb, and and most of you probably heard about how, especially in the early days of COVID-19, when Zoom was being used at rates that they hadn't ever really expected or experienced before, that there were these terrible cases of people hacking into systems, to classrooms, to various groups, and interjecting hate speech or pornography or any number of terrible things. So I wasn't talking about doing anything that bad, but I wanted to just do something kind of a little, unexpected. And so we were talking, and all of a sudden, this it looked like this other person had entered the room, and then this countdown started: 5, 4, 3, 2, 1, and and then there was this really dumb dub smash that I had done that followed afterwards, just a couple of seconds. But I couldn't believe the reaction from people, and that one of the board members was like, "Oh," she goes, "Oh my God, my heart's racing," and I thought I'm going to be hacked, and but it just kind of just shook us up all up a little bit from this glazed, like, stare into a screen, and I was greatly delighted by the experience. And why do I tell you the story? Well, because I just, Thursdays have kind of become an opportunity for me to kind of open myself up a bit and let you know where my head is, and sort of some of the things I'm pondering or puzzling over, and as we make uh, the various decisions, and as we chart our course as an organization, um, so much of that happens in this kind of organic and incremental way. And I feel during this time where so much is kind of upside down and uncertain, and uh, that we're just trying to figure out where we all are, that the more I can communicate with you folks and kind of let you know where my mind is at any moment. It may be helpful in understanding how we're moving forward, and plus then I could, people have some ideas for me. So if you have any ideas out there about ways that you're keeping your virtual meeting experiences human, how you're managing to instill or to ensure some level of sort of digital discipline. Yes, people have to be paused because it makes a lot of noise. Yes, there has to be protocols, but how do we find ways to uh, not let our humanity slip away completely, and to make sure that people are always expecting the unexpected? It has been another long week. Dan and Sharon were great on Tuesday, filling us in on some of the things. And for those of you who are able to uh, avail yourselves of the daily briefings that the governor has been doing, you maybe have been following some of the new information that's coming out. We heard earlier this week about the various stages, or was it the end of last week? It's all a blur now, but and we know that there is much thought and focus on sort of reopening. That's what everybody wants to know. And even as we are kind of waiting further guidance or specific guidance uh, from our own elected officials here in Massachusetts, we're hearing stories of other states that are really moving along at a much more rapid pace than what we are here in Massachusetts, which, um, as far as I'm concerned, that is probably the more prudent way to go. Massachusetts is still among the highest five states that have the highest levels of COVID-19 cases, and and as we've heard from Governor Cuomo from New York, who talks about how he feels that some of the social distancing that they've done has really paid off, and they're just starting to get a handle on things. I think the same can be said of Massachusetts if you read between the lines, or not even between the lines, but some of the successes that we've begun to see. But I so strongly believe that uh, the 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 willingness of our communities to really abide by social distance practices, and how diligent uh, we've been in adhering to the guidance that has come to us has been so fundamentally important to the continued decrease in some of the cases and in the fear that people have had about contracting the coronavirus and not being able to get the kind of medical care because the hospitals were overloaded. Today, Governor Baker spoke about the a number of things, but talking about the increased need for testing or Massachusetts plans to improve the testing. And I thought it was important enough that I threw together a couple of slides, and I'm going to ask Greg to pull them up for me now, because we hear numbers, but it's if you're like me, you hear a number, it kind of goes in one ear and out the other ear. You're not really thinking. And we've had I know we've had families that have been again asking more and more questions about timelines for when they can see their children, and I'm, as you all know, rattling the fence almost daily over at Benchmark, trying to figure out when I'm going to get in. But and you've heard me talk for quite some time now about how I believe that until we get better testing and more uh, higher numbers of testing, that we're not even going to begin to think about how can we reopen in any capacity. So when I heard some of the data today, I thought it would be good to kind of put it into writing and to share it with you. It's short, just a couple of slides, and I promise I'll move through it pretty quickly. But for those of you who are listening and watching, you represent, in my opinion, the most invested and involved in NuPath. So even if just a small fraction of you are paying attention and watching, then that'll be good. But I'm not able to control the screen, Greg. So maybe am I doing something wrong, or can you help me kind of advance the slides?
You try it again, D.
I'll try to get. Well, now I'm hang on a second. Ready. There we go. So Governor Baker talked about Massachusetts' plan to boost our testing capacity. Now, just to give it a little perspective for all of us, as of yesterday in Massachusetts, we have tested 400, or there have been 410 tests provided or were administered. I mean, I can't say 410,000 people because maybe some of those people got tested twice for one reason or another. But that is how many tests have been given. And as of yesterday there were 8,500 tests in Massachusetts. All right. So considering that 65 days ago we didn't even barely had a test for COVID-19, we have made some progress. Total number of COVID cases, I just like to say this is nearing 90,000 in Massachusetts, and there have been 5,300 deaths that have been attributed to COVID. Now, positive test rate, this is another number that is being looked at. Now, the positive test rate means that how many out of all the tests given, how many positives are there? And we are now at a level of 14%. So that means out of every 100 tests that are given, 14 of those tests will come back positive. So for every 100 people getting tested, 14 people are still learning of a positive test. Compare that to a couple of weeks ago when it was at about 20%. That shows improvement. And about a month ago when it was near or hovering around 30%, you can see that there's been a reduction by almost half. So that means that a month ago when 100 people would be tested, there would be 30 that would learn that they had the COVID-19, and that a number of people that would be that diagnosed with COVID has been cut in half in that period of time, and most of that has been done, or all of it's through social distancing, because as we know, there's no medication or vaccines or anything for it. So Massachusetts is working very closely with the federal government and looking to boost the overall capacity of the testing. And they have set a goal. So I just told you that yesterday, and this shows where we are today is a huge increase from where we were a month ago. But yesterday there were 8,500 tests given. Massachusetts is committed to ensuring that by July of this year, that will be increased to 45,000 tests a day, and then by December, that number will increase to 75,000 tests a day. We know that it is so critical that the tests are available to everybody, not just the ones that are feeling sick. That's how it's been so far. But once we start thinking about reopening up our doors and about having staff come in from their homes after all these many weeks away from facilities, and as our people are beginning to move more and more back into places of employment and into situations where their exposure is going to be increased, having rapid tests that will, there may be some people that are tested daily to make sure that they don't get it, because the most insidious thing about this virus is that the spread rate of it is so aggressive, and people can easily, maybe have it and not even know that they're spreading it. But more testing will improve that. Now, what I had said when we talked about this. This positive test rate, going from 30% to 20 to 14. The goal here is to get this down to a level around 5%. And once we see numbers reaching more that level, then I think that the sense is that we'll be able to find ourselves in a zone where there can be more relaxing of some of the social distancing. And we do hope that there's been talk about, possibly being some very positive developments in the vaccine front. Depending on who you listen to, there could be something that could be available in some quantity. Again, it's all so often the devil's in the details as far as how many doses and how you're going to get it to everybody and so forth. But we're hoping that as science and medicine races feverishly to try to address this issue, that we're going to continue to be able to keep the rates low. So, in summary, adequate testing. I've been talking about this for weeks. Testing. It's got to happen. You're going to hear more about the contact tracing. In fact, we were at a meeting yesterday. We were talking about even thinking about using Navigating Life as a way to record and keep data on who have been exposed to whom, and who have people come in contact over the course of their day, and as Massachusetts and other states that are trying to that are tackling this issue responsibly, are hiring thousands and thousands and thousands of people to do just that, to do the contact tracing. It's another component that people in public health and in managing this crisis believe is essential. So that means if you do test positive through one of these 75,000 tests a day in December, that the very first call you'll get is from contact tracers saying, okay, tell us everyone that you've seen, everyone you've been in the same room with over the past, 4 days, 7 days. And so that those people can be contacted and made aware of the situation. As we think about reopening of businesses, there are going to be a whole number of mandatory workplace standards and practices that we need to adhere to. Of course, none of them are new or something that we haven't heard from before. It's going to be the cleaning and the disinfecting of environments. It's going to be ensuring that there's signage everywhere so that visitors understand that there is social distancing requirements, that masks are to be worn, that gloves in some cases may need to be worn, and so forth. So it is going to be upon really upon the employer to ensure that as some of these restrictions very gradually begin to be relaxed, that we are not in some way contributing to a surge or to a rebound of the virus after we've worked so hard together to make sure that we're to try to get some um, a handle on it. And then, as far as I'm concerned, there's a big component that really comes down to all of us doing what is our own personal responsibility and adhering to guidance. I hate wearing masks. I'll just be honest. And I've got some nice kind of cloth ones that should, but I hate the way it feels around my, and I don't like looking at people in masks because I can't tell if they're smiling or what they're doing. It's just weird and I don't like it. But I have my mask every time I leave this house, and I wash it regularly and religiously. And it seems that most of my fellow citizens, at least the ones in my area that I've been seeing, have been doing the same thing. And I just, again, for whatever it's worth, I want to urge all of you and for all of our NuPath employees and the people that we support that are listening, families. I know that on a day like today, when you just want to feel the sun on your face and just forget about everything that's going on, it can be easy to imagine cutting corners. And then I know that it's going to happen where you'll start to see maybe people that are a bit more, reckless, or there may start to become an increasing number of people that are just no longer abiding by some of the social distancing that during the dark days of the deepest fear when we just really didn't know what we were doing, um, people were much more likely to stay home, but it was also cold and raw many of those days, and we're going to be looking at some weather that's going to be gorgeous and where people really want to be at the beach and when they say we're all in this together, I cannot stress that more uh, earnestly for everybody. And I think I just wanted to just end before we close out this a PowerPoint that I had, just again on the heroes that have been willing to work. So even as so many of us have found ways to maybe work from home or virtually or by doing Zoom meetings and phone calls and so forth, it really is the staff that are stepping up and going and working face to face with our folks every day that deserve the highest praise. And we salute you all as an organization and personally thank you all so much for all you've done for us. So that was a little sort of classroom didactic, but as I started to kind of just look at those numbers and force myself to really look at them with kind of a clarity, it just made me aware of just how much more we still need to how much more we need just to continue to evolve in the whole area of the testing. So that's kind of like a precursor to this next quick issue. Well, it's not quick, but I'm not going to spend too much time on it today because it's still something that we're waiting for guidance from the state and in a few other things. But this is the area of our families, our dear families, and some of the questions that we've seen. And I know the urge, the ache, the sadness of being separated from your children for so long. I'm sure that there are many of you that have never been distanced from your children as long as you have been during the past, whatever, 65 days. Um, I, I wish it wasn't the case, and I am sorry that you are experiencing this unnatural and it's a really inconceivable sort of situation that you are not able to just pick up your kid whenever you want or have them home for the weekend or stop by and visit. Um, but we are doing this, as you know, to protect you and to protect your children. Um, I maybe shouldn't always compare it to what I'm going through with my own mother, but I certainly understand the pain of not being able to do something that you feel like you can only do for your child or for your loved one. And so we've been hearing about a number of other organizations that have begun to relax some of their what reportedly at the beginning were much stricter protocols. Although I wonder if they were ever as strict as what we've assigned. But people, I'm going to tell you something here. We are at the lowest numbers of cases of COVID, and that's for staff and for folks. The last person moved out of the New Boston Center. What, Monday or Tuesday or whenever it was. It's we don't have everybody there now. And when I think about how this compares to what other organizations are still facing, and we're still hearing that many parts of the state are enduring what they are referring to as their surge. Um, I believe the reason that we have been able to manage things as I don't want to say easily because it's not been easy, but where we've kept the numbers low on the people sick and never gotten beyond what we built capacity to care for at the center. That's not by accident. That's because of the diligence of the staff and of the patience from our families and their willingness to trust us and to understand that we are only doing this to protect the health and wellness of the lives of everybody. So I certainly not anytime in the next couple of weeks, few weeks, will families be welcome to take their children home. That is not something that at this point in time, and as more guidance becomes available, and as things change, that could change. But that's not something that we're talking about right now, and nor are we talking about families coming into the homes themselves. Um, what is much more likely to be kind of a first stage for us would be having families come to some sort of a social distance cookout in the backyard, you know, spending some brief time of engagement, in the driveway of the home, being in outdoor spaces where both you and your child would be wearing gloves and at least a mask and are keeping at least 6 feet apart because we it's too great a responsibility, and our staff have worked too hard, and our nursing team have um, just really pushed themselves beyond the limits of probably anything most of them expected they'd ever go through in order to get to where we are now. And as much as I know the hurt and the pain of being not able to be as connected as you'd like with your kids, I am really going to be insisting here and expect that staff will abide by that until we get some reason to believe that things are relaxing in other industry as well. And we're tomorrow, as a matter of fact, going to be celebrating at our Unity Forum some of our families, and we're going to have some. We have a father and son combo, a mother and son, a sister and sister, and kind of as a shout out to our wonderful and amazing families that are out there that have done so much to support our teams and the staff that are reaching out and trying to help each and every day, and but also the ones we're going to be talking to are the ones that have embraced some element of our virtual platform of programming and learning, people that have really been consistent, that have used the tools that we've made available in practical and functional ways that is helping people to kind of manage during this time, unlike any other before us. So we love you, families, and we're continuing to try to stay true to our convictions about this. And you've probably heard it said by many others before me, but we've come so far, and we've put ourselves through so much sacrifice and discomfort and pain and loneliness even at times, that to stop that now or prematurely and then end up with this big resurgence of COVID-19 diagnosis. It's just not something that I think any of us would want to, we just wouldn't feel the sacrifice was worth it. So um, that is where we are. So I said tomorrow's going to be great. It's going to be a lot of fun. I had a blast at our last Unity Forum. Love mothers. It was great talking to the moms and got some just just really lovely feedback from many of you out there, and just couldn't be happier than I am to place my role in getting people together and helping people tell their stories for a broader community. These are our people. We belong together, and it's just been terrific learning more about what's going on in different sorts of corners of the organization. So I'm going to check in with Greg and see if there's any questions that I could or should answer, and trying to end these things a little earlier than
Yeah,
early.
nothing specific. Just a reminder to some folks who are looking for specifics on numbers and whatnot, to either tune into a Tuesday forum that has some of more of the specifics, as well as they can go to our website and actually watch that back. But other than that, no other questions.
Mm-hmm. Yeah. So yeah, if you're somebody that doesn't or not able to make it to when these are broadcast live, there's definitely a couple places you can access them, either on our website or on a YouTube channel. And guess what? If you don't want to listen to 34 minutes of me talking, you could increase me to 1.75 speed, or I think even faster than that. Sounds pretty funny. You get through it a lot faster, and maybe still get the information that you need. So consider doing that while you're driving or walking or doing something else that is otherwise occupying your time, and that will help us to not have to repeat much of the information that we provide through these virtual forums for the wide majority of folks. So, all right, everybody, stay strong. This is we're doing this, and we're out in this brave and ever-changing new world of ours, and we got this. Totally got this. So hope you'll tune in tomorrow. It's gonna be a lot of fun, and have a good night. Okay, bye guys.